Very informal.
Okay. Hi, everybody. I'm Elayne. I'm one of the physical therapists at Rebalance Physical Therapy. And I'm going to talk to you today a little bit about having tight hip flexors, especially during pregnancy and in the postpartum period. So oftentimes during pregnancy, everything's growing forward. Your breasts are growing forward, your belly's growing forward. And what that tends to do is it puts you into more of this anterior pelvic tilt. Well, as the pelvis tilts forward, what happens is your hip flexors, which are these muscles on the front of your thigh and go through your abdomen deep, pull your pelvis into that more anterior tilted position, and they get tight in that position. Start to hurt. Sometimes they can feel very cramped. So we're going to talk a little bit of how to stretch those. People oftentimes get into these big lunging positions trying to stretch their hip flexor. This actually can do more tightening or damage. What the iliopsoas, or the hip flexor, wants to do when it gets to its stretch to the furthest point is it wants to clamp back down. So that tightens up further and can cause pain either on the front of the hip or in the groin or down deep into the lower abdomen even. So if you're doing a hip flexor stretch, you don't want to take it necessarily to the end range. You want to go to a shorter position. You can do things like adding in the quad stretch to it, so you can reach behind and grab for your foot. That'll give it a little bit more of a stretch. So you'll get your quadricep on the front of the leg and you'll get your deep hip flexor. This is better than putting yourself into that deep lunged position. Another easy one you can do, especially during pregnancy, is you lay on a bed or a table or and you're going to hang your leg. I'm going to fake it here, but you're going to hang your leg over the bed and let it hang all the way down to the side. So the key here, though, is to make sure that your back doesn't arch off of the bed. So you want to tighten your lower abdominals, keep that down, and then let the leg hang off, and that'll give you a nice long stretch, gentle stretch through the front of your thigh so that it's not so tight and restrictive in that area. I think that's it. If you are in the Philadelphia area and you need an evaluation on your posture and what stretches to do during pregnancy and postpartum, you can give us a call. Go to our website at www.rebalancept.com.